The reality is that individuals who suffer with the amputation will likely suffer from a loss of life later down the road, typically within 5 years from a major amputation. So if we don't save the limb, we don't save the life.
Windsor's lower limb preservation strategy is a collaborative effort between Windsor Regional Hospital, Windsor Essex Ontario Health Team, the Windsor Family Health Team, and partners such as the City of Windsor and its shelters, which are called the H4.
So partnerships have been very important to how we can tap into the various populations of need, specifically looking at lower limb health. So whether it be the City of Windsor, who's leading the homelessness initiatives across our city, so connecting us into the locations where they're providing supports and services to individuals who are living in the streets and struggling with various chronic diseases and, of course, lower limb health.
Working with the Windsor Family Health Team and Windsor Regional has been amazing up to this point, and through initiatives like the lower limb prevention and others, it has snowballed into municipalities and service and supports for folks experiencing homelessness to become more involved with healthcare.
The major thing about this initiative that we've created is helping to bridge the gap between community care as well as the hospital setting, which has allowed for faster access to a lot of the patient's care, faster support, which then leads to improved patient outcomes.
It's the kind of wound care and supports that we're providing in this clinic, this wraparound care, this barrier-free care, and I think that's the key point. And so that engagement, understanding where people are at and doing what we can to meet the person where they're at is so critical.
I came in and I had a foot wound that wasn't healing, and it just kept getting worse and worse and worse. So it's been very stressful economically as well as psychologically. As a diabetic, I need to walk and be healthy and move, and as a person with like arthritis as well, if you stay still, you will stay still. I've had kind of a sedentary sort of life since this has happened.
So we find that our model provides a coordinator of care, especially for those patients who don't have primary care in the community. So patients have been referred by walk-in clinics, urgent care clinics, the emergency department, to our program, and the nurse practitioner, Harleen, assesses their risk and what their needs are, and she'll help coordinate that care with the Ontario Health at Home wound care clinics. She can also help coordinate referrals and tests, so referrals to endocrinologists, to a vascular surgeon, tests such as x-rays, bone scans, and the like.
Wound care, access to wound care products is something that we have felt is really important, whether that be special bandages all the way to offloading devices, compression stockings.
I've had good support from everybody here. They've been really diligent in taking care of my issues and like working behind the scenes to make sure everybody's coordinating together. And they handle my prescriptions, over the phone from my pharmacy right away. And I got Cooner Physiotherapy, got me diabetic shoes.
To connect this program to the community and to other practitioners and make it more accessible to other primary care practitioners and patients themselves, we're providing a lot of education in this regard. So I've been involved with 2 webinars.
So what we've done is we've developed educational tools, as well as provided the shelters with wound care products appropriate to support the needs of the people that they're serving.
And what we have seen even a year in is that we are no longer seeing the complexity of wound care needs that we had seen even a year ago. We are seeing individuals that have early access to wound care and proper bandaging, which is creating reductions in having to have folks go to the emergency room.
So we lessened our ED visits. We've improved the care that we can provide to these patients to prevent admissions, which then supports our hospital bed spacing.
We're seeing fewer amputations, and that ultimately is the goal. But we're also improving the quality of life for individuals who are receiving the care. It's really been a mini village that we've created in order to make this initiative a success, and essentially we're the clinical glue in the ground level to see those individuals and to make sure that they're accessing those systems that we've actively worked on to create.